And Stephanie, I made you co-host if you don't mind helping me with admitting people into the room. Okay, there we are. So we are live and we're ready to go. Would you like me to get started, Justin, Lisa? Do you guys have anything you'd like to say first?
See here. I don't have a lot to say other than, I guess a couple things. Number one, appreciate how conscientious staff have been about sharing their symptoms and getting tested. I know in some cases staff members have done that of their own volition, and I think that's helped us mitigate some of the exposure and risk here. And then secondly, I feel a lot better about things than I did at one point yesterday, because we have had quite a few negative tests at this point, and that's included students and other family members and multiple staff people. So anyway, so that's good news at the present time. So that's all I would have to say right now.
All right, so we'll just go ahead and jump in. Everybody, my name is Katie Lindstrom. I'm the director at the health department. We also have Stephanie Michael, who is, for at least the rest of this week, she's our lead COVID response person for Pacific County. So she'll be jumping in as well and answering questions. What we wanted to do today is just meet with you all to provide some information, number one, about the current situation at Naselle, and also just about the county process and what happens when we have cases in the school. A lot of it is just around identifying who are those close contacts, who are the people who really, need to look at quarantining, getting tested, and who doesn't. So we have some slides to go through, and then we will have time to answer questions. Feel free to go ahead and put those in the chat box as we go, and then at the end we'll just kind of read through those. And we'll also give you a chance to just verbally state your questions if you prefer to do that at the end. So first of all, I just want to talk through the process of what happens when there's a positive case in the school. The first thing that happens typically is that public health is notified of a positive case. Sometimes we might actually get notified by the case that they're positive first, and that would be if they got tested out of county and we didn't get the test result. They got their test result basically before we did. But typically speaking, we get the test result first. We call that positive case and we isolate them for it's a minimum of 10 days. It could be longer, and I'll explain that later here in a minute. And by isolate, we mean isolate. So they need to not be going to work. They should be isolated away from other family members at home, potentially like in another bedroom. Or if they need, then we can provide isolation housing. We have some trailers we can put people up in. But so that positive case is isolated. And then we begin the case investigation process. And I'm going to go ahead and ask if you guys can mute yourselves. That would be helpful right now. Thank you. What then happens is we contact the school, and we've done that. We've been working with Lisa and Justin over the last few days, and we work with them to determine who else might be a potential close contact and somebody who we would need to follow up with and quarantine due to their close contact with the positive case. So the school is going to provide us with a list of names and phone numbers of potential contacts. We then call those potential contacts and determine if they're close contacts. Just because you're a potential contact, meaning somebody who could have been exposed, does not mean that you automatically become a close contact. There's some real specific definitions for close contact, which we'll talk about in a couple slides from now. So then based on all of that, we make some decisions about either closing down a classroom, quarantining staff or students individually, or potentially closing down the entire school. It really depends on the situation. And so that's what that investigation sort of unravels. And then the decisions are made in consultation with the school district and the health department. Our health officer gets involved, and then we make those decisions. So I had mentioned the phrase potential contact. So what does it mean to be a potential contact in the school? A potential contact would be anyone who was on the bus with a student who might have tested positive or a staff member who tested positive. In the classroom setting, it's going to be students and teachers who spent the majority of the day with that student or teacher. So we go based on if you spend about 50% or more of your day with a student in a classroom, you're going to be a close contact. We also look at lunchroom, and every school does it differently. Some schools eat lunch in the classroom, some eat in the lunchroom, but depending on how that looks, some people who ate lunch around that student or staff member may become close contacts. We also look at playground contacts, and then anybody else who spent more than 15 minutes with the positive case closer than 6 feet. And that 15 minutes is cumulative throughout the day. So if you spent 5 minutes in the morning talking with somebody up close, and then another 10 minutes later in the afternoon, that would be 15 minutes cumulative. And again, that's got to be within 6 feet of the other person. And it doesn't matter if you're wearing a mask. Wearing a mask is definitely going to be better, and it's going to lower your risk. But if you were within 6 feet for 15 minutes, you're going to be considered a close contact. Now, it's really important to note, just because you're a potential contact, it does not necessarily mean you're going to become a close contact. This potential contacts are the big pool of people who we look at to whittle down and determine close contacts. So again, just because you're a potential contact does not mean you're necessarily a close contact. So what is a close contact? Again, it's going to be anyone who meets that 6 feet, 15-minute definition. You had that contact more than 15 minutes, closer than 6 feet with the positive case. And it needs to be on a day where the positive case was infectious. The positive case is considered infectious 2 days prior to when they first exhibit symptoms. If they are an asymptomatic positive case, it would be 2 days prior to the positive test date. And then again, due to duration of time spent, anyone who spent all day or the majority of the day in the classroom with a positive case, they would be considered a close contact. And that's even with proper mask use and distancing. And again, those things are really going to reduce your risk. But given that you're a congregate setting where a lot of people are coming in, we have chosen to be extra cautious with schools and go ahead and include anyone who's spending the majority of the day in the classroom with a student or a staff as close contacts, even if they're wearing masks and even if they're distancing. So this is typically going to apply to like any elementary classroom. And then middle and high school, it really depends on your setup. If you have students cohorted and they're together all day, then it would apply to that. But if you have, students moving around from classes, then it's a little bit more of a case-by-case basis. And then again, the last group to figure out close contacts is you're going to look at those bus, lunchroom, and playground contacts, and you're going to determine based on the duration of exposure, mask wearing, and proximity. Those are the factors that we look at to determine if those bus, lunchroom, or playground potential contacts actually become close contacts. So what happens is once you're determined to be a close contact, our public health nurse calls people. I believe also your administration notified people. Is that correct? I believe so. Yeah, at least with the students you did. But we also at the public health department will call you. So if you do not get a call from the public health department, that means that you're not a close contact. Now, that said, if you get a call from the public health department, please answer the call. It's really important for us to be able to connect with you and put you on quarantine, and then also make recommendations regarding testing. We do really encourage anyone who's a close contact to get tested. And then we also encourage anyone who has symptoms, whether you're a close contact or not, we encourage you to go get tested. So here's the current situation at Naselle. We have 3 confirmed positive cases, and it says junior, senior high there. I'm sorry, that's a remnant from my South Bend presentation. So we have 3 confirmed positive cases in the school, and you guys are all one big school building, so within the school building. The individuals who tested positive are in isolation for a minimum of 10 days or 24 hours after symptoms improve, whichever is longer. So it's 10 days minimum. It could be longer depending on if they have, a bad case or a case that goes a long time and they're not improving with their symptoms. The last date of potential exposure was for case number 1, it would have been on the 9th. For case number 2, it was on the 10th. And for case number 3, it was on the 13th. So we have the 3 cases. Again, students and staff who spent more than 50% of class periods are considered close contacts. So I think you guys are aware we did quarantine the B cohort of 4th graders. We also quarantined all of the office staff who were in and around the positive case there. And that was because they had spent the majority of their day in the same general area as that staff person. So other close contacts determined on a case-by-case basis. Now, I think you guys are aware that Naselle is going to be closed down until the 30th. The reason that the entire school building is going to be closed down, which is a recommendation that we worked with jointly with the school district. Our health officer agreed with a decision to go ahead and close down till the 30th. And the reason for that is we could not rule out that at least 2 of the cases were connected at the school. We don't know that for sure. There's no exact science to this, but what we do during our contact investigation is we try to link cases together. So if you have, say, a student who comes in, they're positive at your school, but we're able to link that student as a family member of another adult who got it at work somewhere else. And we can clearly kind of say that didn't happen at school. There was not an exposure at school. In that situation, we're not going to be likely to shut down a school building. We would be likely to shut down the classroom where that student was, right? So like the 4th grade B cohort. But again, because at least 2 of the cases at Naselle, we were not able to definitively link that they got those cases from outside of the school. That's why that recommendation was made to shut down Naselle until the 30th. Also, I'm sure people are aware, we're experiencing a huge surge in cases in the county. I feel like we're getting hit with more and more cases every day. Our case rates have never actually been this high or even close to this high. So I think also just in the sort of the idea to get a little bit of a reset and kind of take a breather and sort of reset and hopefully kind of clear things out. That's the other reason why we're looking at that closure. So again, close contacts of these cases are on quarantine for 14 days, which is through the end of the day on the 23rd for case number 1, end of the day on the 24th for case number 2, and end of the day on the 26th for case number 3. Now, it's really important to note, if somebody's a close contact and they're on quarantine, they have to stay on quarantine for 14 days, no matter what. Even if they come back with 5 negative test results, it doesn't matter. They still have to be on quarantine for 14 days. The reason for that is the incubation period for COVID is 14 days from the last date that you were around the positive case. A lot of people don't develop symptoms or have enough, don't develop COVID enough to test positive. It could take up to 14 days for that to happen. Typically, it's around 5 to 7 days, but it could be sooner. It could be all the way up until 14 days or even longer. So that's why that 14-day quarantine is required no matter what, even with a negative test result. People who are close contacts have to stay in quarantine for 14 days. And again, close contacts or anyone with symptoms, we really encourage you to get tested. And close contacts will be contact public health. And again, just that we jointly made that decision to close school for everyone through November 30th. So this is obviously a question I'm sure is on people's mind. What about other students and staff who are in the building? So students and staff who are not in the classroom with the positive case and who have not been identified as close contacts do not need to quarantine. The risk is actually pretty low at a school building for spread of COVID, and I'll share a little more information on that. This is largely due, to 2 factors. First of all, kids, especially younger kids, are just not shown to be as effective at spreading COVID as adults are. They just don't seem to spread it like adults do. So that factor is very beneficial to the school. The other factor is you guys, from what all I've heard, and all of our schools in the county have been really good about enforcing and employing all of the safety procedures. That's not the case for all workplaces. There's a lot of workplaces that sort of ignore maybe the mask wearing mandates. They don't ensure distancing. They're not staying up to standards on the cleaning, but that is not the case in the school. You guys, I think, are doing a really good job of ensuring that distancing is happening, that masks are being worn. And because of that, you actually have a relatively low risk of spread of COVID in schools. So That's a really good thing working for you guys, and definitely kudos to all of the staff who are really taking this seriously and on top of this, because it really does make a difference. So anyway, that being said, if you do develop symptoms, whether you're close contact or not, please go get tested. We encourage that of everybody and anybody. The quicker we can catch a case and then sort of cut it off through contact tracing, the better, and the fewer people that can end up being affected because of that. And again, if you don't receive a call from us, from a public health nurse, that means you have not been identified as a close contact. For those people who would like to get tested, either because you're a close contact or otherwise, we do offer through the end of November anyway, we have drive-through testing on Fridays in Long Beach. You can call the EOC at that number there, 642-9407 for an appointment. Willapa Harbor Hospital, they're very busy, but they are doing Monday through Friday, 12 to 2, no appointment necessary, drive-up testing. Like I said, they're very busy. They're doing a lot of tests right now. We are real close to standing up another testing option in South County that should be online around December 1st. I don't want to announce that yet until everything's totally finalized, but we will have that option soon. And then the other option is always to call your private healthcare provider for testing.
Katie?
Reminder, you have to quarantine from the time you're tested until you receive your results if you're a close contact. Close contacts, you need to quarantine from the time you're tested until you receive your results if you're not a close contact. But if you're a close contact, you got to stay in quarantine for 14 days regardless.
Katie, I have a question.
Okay.
It was the back of the slide. You mentioned testing Monday through Friday. Have they added Friday, or did you mean Monday through Thursday at Willapa Harbor?
Oh, I'm sorry. Monday through Thursday, Willapa Harbor. The slide's correct. I probably said it wrong.
Okay.
So Monday through Thursday for Willapa Harbor. Fridays is what we do in Long Beach at the health department. You have to call for an appointment. We actually don't do it at the health department, but we do it in Long Beach, and it's our nurses that run that. All right, so this is, again, I kind of already touched on this, but this was put out by LNI and basically just stating that the overall health risk is very low in a, excuse me, in a K-12 instructional setting. And again, that's because of all those safety practices that you're putting in place, the daily symptom screening. And I've heard that you're good about sending kids home and staff home if they have any symptoms. Even if it's a headache or a little bit of a cough or anything like that. Even if you think it's something else, it's really important that you stay home if you have a symptom, because COVID tends to start out as a little bit of a headache or a little bit of a cough or a runny nose. So it's really important that you stay home if you are sick or have any symptoms. It's very important, obviously, with the masks being worn at all times, social distancing being maintained, hand washing, and then that increased sanitation of high touch surfaces. I think you guys have probably seen this, but we like to just show this in just about any presentation we do, just the effectiveness of mask wearing and distancing. It's really dramatic how much it can reduce risk. Of course, it's not going to be 100%, but especially when you layer the interventions and you're doing the mask wearing and the distancing, it's very effective at reducing your risk. So this just kind of shows, it's a very high risk when people are closer than 6 feet and nobody's wearing a mask. It goes down slightly if, only the healthy person's wearing a mask. It goes down even a little bit more if only the sick person's wearing a mask. We're down to low when both people are wearing a mask, but you're still closer than 6 feet. And then you get to very low. And this is what the setting at the school should be, is that everyone's wearing a mask and everyone's social distancing. Just resources in case you have questions. You can call the EOC Monday through Friday, 8 to 4. That's the same phone number that you call to get scheduled for testing. We have our COVID-19 website. This is a county website that we keep up to date with resources and information. And then the state website is actually really good as well. So the coronavirus.wa.gov, lots of good information, up-to-date guidance. They tend to be even a little bit more up-to-date than we are, definitely with state level information. So just some resources there. And then again, questions, there's the phone numbers again. And with that, we can go ahead and take questions that staff might have.
I don't have a question. I do have a comment. I just want to thank you for doing this for us, spur of the moment. I know we've been talking every day. We're best buddies now, but for the rest of you on here, I sit in with regional superintendents on at least one meeting a week. And the superintendents in the other counties are really struggling to even get information from their county officials, communicate with them, get a phone call. So yeah, I just want to express my gratitude for how helpful our county has been and responsive. And I can assure you with 100% confidence, it is not that, not going that well for other schools in other counties and trying to get support and assistance and people to weigh in and talk through situations. So kudos to Katie and her staff.
Thank you. We do have a great team, and honestly, we see this as a partnership with the schools, and we want to do whatever we can do to support you guys, because you guys are doing the really hard work of the day-to-day operations at the school, making kids wear masks and keeping them apart. I can't imagine. That does not sound easy to me in any way. And so we really do want to just support you in whatever we can to try to help you guys through this. I'll go ahead and answer. I see just one question in there right now. If you guys want to chat any other questions into the chat box, that'd be a good way to do it. Or you can also unmute yourself. But I'll start with this question. Is there a risk of running out of testing materials because of the surge in cases? Good question. Stephanie, do you want to talk to that?
Sure. So far, we haven't seen this in supply channels. We meet with our healthcare providers 3 times a week. We also work supply requirements through the Emergency Operations Center. We've also been working to kind of stockpile supplies over the last few months as testing kits and things have been available. So we're feeling okay with that. The other side of this is kind of where we've seen it before with surges, is the testing timeline. When things get delayed a few days, then what we were usually getting a good turnaround on those test results, because the throughput through the lab facilities is just exploded. So that's probably more of the impact we'll be feeling than the actual supplies themselves. That's not to talk about certain things. I know, every healthcare kind of has their own way and mechanism of testing. And so sometimes there might be shortages specific to that, but then we switch gears and try to test with another testing option that we have. So again, a lot of coordination and piece on that, but more so the impacts on that testing timeline than the supplies themselves at this point.
Yeah. And I will tell you what we're moving towards with this new South County testing option, which I would imagine a lot of you guys may, that might be more convenient to access than Willapa Harbor Hospital. But what we're going to have set up there is it will be a rapid test and a PCR test at the same time. So what currently happens is a lot of people get a rapid test. It'll come back positive. The rapid tests are great because they tell us usually same day if someone's positive or not. But they're not as highly reliable as the PCR test, which is the lab test that can take typically 3 to 5 days or so, sometimes a little longer to get results on. So what we have to do is anytime someone has a rapid positive, we have to confirm that with a PCR test. And so typically we've been doing rapid test positive, and then we get the result back, and then we schedule them to go get a PCR. But what we're going to move towards with this South County setup is just having both tests done. So people will get swabbed 2 times, but they'll only have to go in once. We'll get the rapid result right away, and then we can start the contact tracing and whatnot based on that rapid result. And then we can go and we'll get the PCR confirmation a few days after that, and it'll save us that step, and it'll save people that step of having to go back for the PCR confirmation. It's probably as boring to you guys, but it's been like it was a logistical thing that we really needed to work out because it creates a lot of extra work for us and also for the testing staff.
Another just highlight on those rapid tests, most of them are not usually as effective if you don't have symptoms. So again, if you're just going to go drive through to get a drive-through rapid, if you're not symptomatic or you haven't been identified as a close contact, it really isn't doing much benefit there. So just kind of an awareness in the use of rapid tests.
Exactly. All right. Any other questions that people might have about the cases or the process or anything else COVID related? Okay, well, I think then we are probably good. We're going to do another meeting tomorrow night, correct? Tomorrow night at 6 for parents and any other community members who want answers and want some information. It'll be the same presentation that we did today, but just we're going to offer that out as well because I'm sure you're getting questions from parents. But otherwise, thank you guys all for taking the time to meet with us today. And again, reach out if you have any questions. All right, thanks
you.
everyone.
Really appreciate it.
Yeah, thank you. Bye.
Stay strong, everybody.